So good day, everyone. My name is Victor Diaz, and I'm the Communications and Capacity Building Manager at the ECLT Foundation. I am very happy to be here and delighted to be your moderator today. We would like to thank you for your participation in this webinar. Today, we're joined by different speakers who will share their insights and experience on stress management and mental health issues in farming communities. We will also like you to share your experience during the interactive session after the presentations and to participate in the polls that we'll be launching during the webinar. You can also share your comments and questions in the chat box. And also this webinar is being recorded and will be shared on the ECLT's social media and on our e-learning platform. So our presenters today are Robin Tutor Markham. She is the former director of the North Carolina Agromedicine Institute. With her extensive experience in occupational health and well-being, she will lead this discussion on stress management. We also have Muyaratsi Nemakchena. Sorry if I pronounced that wrong. He's the senior project officer at Childline in Zimbabwe. So Childline champions and promotes the protection of children in Zimbabwe through the provision of safe, confidential reporting and supports mechanisms and therapeutic and knowledge management services. We will also are lucky to have the perspectives of different farmers from Zimbabwe and Malawi and maybe Ghana. So we will have Moses Mukabeta and Andrew Namakoma. They're not only ECLT's consultants in these countries, but they're also experienced farmers. They're going to share their insights in this critical subject. So without further ado, I give the floor to Robin, and so we can start the discussion on stress management and the best practices in the farming communities.
All right, thank you so much, Victor and Innocent, for the opportunity to be a part of this today. This is an area that I have been working on with some great emphasis for the past 12 years at the North Carolina Agromedicine Institute, but I'm also from a farm family here in North Carolina. And so this is both personal and professional interest for me. And one of the things that I hope that will come out of our time together is taking some of the fear out of discussing this topic, because quite often I know that it is a taboo subject or a subject that people don't want to talk about, but we have to begin the conversation somewhere. We have to plant that first seed to be able to make a difference. And so I really hope that by the end of this, that you will be more willing to talk about this and also know some resources that you can access to be able to use in your own country. So next slide, please, Victor. So what we'll be talking about during our time together is I want to give you just a little bit of insight into what suicide statistics look like globally and some of the issues that exist with those statistics. A brief look at the causes of farmer stress, and we're certainly going to hear from our farmers who are joining us today about what kind of stressors they face. What are some of the signs and symptoms that a farmer themselves may experience or that you may recognize in a farmer that they may not recognize themselves? and also some good practices in managing farm stress. Next slide, please. So one of the things that we know is that globally, the availability and quality of data on suicide and suicide attempts is very poor. According to the World Health Organization, there are only about 80 member states that have good quality vital registration data that can be used to estimate suicide rates. So this problem of poor quality mortality data, it's not unique to just suicide, but given the sensitivity of suicide that I just mentioned, and even suicide being illegal in some countries, it's quite likely that there's significant underreporting and misclassification, which present greater causes for having a true handle on suicide than for other causes of death. So you need to just be aware that any statistics that I might share with you today, or any statistics that are available in your own country or through an international organization, you're just going to have to take them, as we call it here in the US, with a grain of salt. So know that the problem may be much bigger. And one of the things that we really need to give attention to is being able to improve the surveillance and monitoring of suicide and suicide attempts. So if there's not a good registry of suicide in your country, if hospitals are not keeping good records of suicide attempts, or if countries are not doing surveys to collect data, then those are areas that need some attention. Right, next slide, please. So one of the things I want to mention is that there are several places in the slides that I have here today that do have QR codes, and if you want to take advantage of those, please do. But this chart is from the World Health Organization, and their goal is to reduce suicides by 1/3 by the year 2030. And you'll see these statistics are a little behind time. The latest statistics that WHO has to offer are from 2019. It takes some time to get this information collected and analyzed and published. But the most recent data for them was that more than 700,000 people died by suicide in 2019. And that a fourth or the fourth leading cause of death among youth or young people 15 to 29 years of old or of age was suicide. 77% of suicides occurred in low and middle income countries, and 58% of suicides happened before the age of 50. So this is definitely a concern for the younger generation, and probably we would say the most active work years of our population is suicide. Next slide, please. So there are many general risks to suicide, and I put some of those here. Certainly there are vulnerable populations such as refugees, migrants, indigenous people, lesbian, gay, bisexual, transgender, intersex persons, people who would normally experience higher rates of discrimination have higher risk for suicide. But we also know that things like a breakup in a relationship, if there is a chronic illness, pain, individuals who feel isolated, who feel hopeless, maybe because of whatever is going on politically or economically in their country. Men have a higher risk for suicide, alcohol, substance abuse. So many general risk that may make someone more likely for suicide. Next slide, please. One of the things that I talk about is compounded risk factors for suicide among farmers, because our farm population, all those things that I just mentioned may apply to them. But when you add issues associated with farming, so the weather, and I know that India has just experienced a very significant weather event, market prices, equipment failure, if someone has been on a farm, their family has always farmed, and a time comes when they are no longer able to continue farming that family farm, that legacy pressure of being the generation that is no longer able to farm. Regulations, environmental pressures, tariffs, and other taxes. There are just many other things, and these can all happen at one time, forcing an individual into a place where they just feel like there's no other way out than suicide. Next slide, please. So it's estimated that around 20% of global suicides are due to pesticide self-poisoning, most of which occur in rural agricultural areas and in low and middle income countries. Other common methods of suicide are hanging and firearms. So one of the resources a little further in the presentation I'm going to share with you is called Live Life, which is from the World Health Organization. So it provides an implementation guide for suicide prevention, knowledge of the most commonly used suicide methods. And the point is that you want to be aware of access to means for suicide so that you can do put some prevention strategies in place to limit access. Next slide, please. So one of the things that I did was to do a study with farmers here in North Carolina and to ask how they dealt with stress. And so these were some of the most common things that if they could figure it out and reassure themselves that everything would be okay, then it would be okay. If something was stressing them, like they were not having enough money for their household or for their farm, maybe they would just ignore it. Maybe the problem would just go away on its own. And perhaps the easiest thing to do was just to try to repress the stress. So maybe eating too much, maybe drinking too much, maybe too much reliance on substances. I had one farmer during COVID who had financial issues, and I said, "How did you deal with it?" And he said, "I smoked a lot of marijuana, a lot." And so you'll see these strategies of trying to cope. One of the things we know is that people who are stressed don't necessarily tell their friends, other farm related organizations they work with, other professional people who might be in their life, like lenders or people they're selling their product to, anyone who's providing them with technical assistance, and most certainly not their family. Their family is usually the last to know that there's something going wrong with the individual themselves or with the farming operation. Next slide. One thing that was very prevalent, though, was that if the individuals were people of faith, if there was a higher being, then they would rely on that spirituality and that connection to help cope with their stress. Next slide. So many times people will have physical complaints that can mimic things like a heart attack. So you may have chest pain, hands may be sweaty. There's a rapid heartbeat or feeling like there's an elephant standing on your chest. Many things come out physically when in reality it's not physical at all. It's actually a physical manifestation of what is going on emotionally and in one's mental health. Next slide, please. So the very best practice that I can share for anyone who is in a farming situation is that self-care has to come first. And that's not the case. Our land, our crops, our animals, that all comes first. But that's how we end up in the situation of individuals who complete suicide. And we have to be able to identify things we can't control and do the best with what we have. So we cannot control the weather. We cannot control the markets. We cannot control the tariffs. We have to realize that those things are out of our control, and we have to be realistic and adjust. And we think that we're the only one in that situation, when if we take time to look around and to talk to others, we quickly find out that there are many other people in the same situation. We have to be able to talk to our family and others about what's going on, because we can't solve everything ourselves. But if we have others help us and share that burden, then we can do better. Being realistic, we always want to be a farmer. We always want to take care of the farm and pass it to the next generation. Sometimes we have to be realistic that we can't. If there are health concerns, we need to address them. Many times it's not until a farmer is having a heart attack that they show up with a healthcare provider. We have to take care of our bodies, have a consistent routine, get some sleep, and treat farming like what it is. It is work, it is an occupation, and we have to have a schedule and be able to make time to rest and take time for our families and others. Next slide. So if you think about this, if you use all of your fertilizer at the beginning, or if you use all of your fuel, or if you use all of your money, or if you have a pump for irrigation or something, if you don't have fuel for it, or if you don't turn it on, if you deplete all your supplies, then you're not going to be able to be productive. It's the same thing with our mental health and our emotional well-being. If we deplete all the positives and we are only dealing in the negative, then when the next crisis comes, we don't have any positive reserves to draw on. And so it's very important that we take time to replenish, to renourish our positive well-being and our positive spirit. So one of the things that I'm included here is actually from another state, North Dakota, and it's called 12 Tips for Your Wellness Toolbox. And I encourage people to choose just one thing. So maybe it's talking to the family about what's going on. Maybe it's getting that health checkup. But there are things that we can do to build our positive reservoir, if you will. Next step, or next slide, please. So there are a couple of tools that I want to encourage you to look up. One is called box breathing, and one is called mindfulness. So when we're overwhelmed, anxious, can't breathe, just feel like our heart's beating and too fast, and that we're just so anxious, we need to calm ourselves. This box breathing technique is something very simple, very easy to do, and so I'm going to encourage you to look that up. The other thing is that sometimes our heads just get so full of what have we got to do next? What's broken, what animals need to be cared for. It's going to rain, so if we have crops that are going to be ruined by rain, how fast can we get those in? We've got to talk to someone about finance. Our head looks like this cloud on the left, but there is a practice called mindfulness that will actually help you be able to focus on one thing. And that's very difficult in our fast-paced world. But I want you to think about looking this up and learn how to practice both box breathing and mindfulness. And these are things that you can share with others. Next slide. So I've talked to you about how you can do some self-care, but how do you know that someone else is having a problem? And these are some of the most common ones that we see here in the US. There's a decline in the care of crops, animals, and the farm. We see that their appearance starts to deteriorate. They aren't participating in social events or meetings, or you just don't see them as part of regular things that they would normally be engaged in. Their routine changes somehow, like the time that they start work changes, or the time they eat their meals changes, or just something is not right about the way that they are moving around and doing things. They start to complain about not feeling well. They have more accidents in farming. Their family says that their personality has changed and it's very difficult to be able to talk to them or engage with them in any way. They start to say things like, my family would be better off without me. My gun or this poison or a rope, or maybe I'll go down to the river and just drown myself. So they may start to say those things, or they may say, I just came to tell you goodbye, or here's a possession of mine. I'm not going to be needing that anymore. Please take it. And here in the US, we also see that people often will increase their life insurance. So people will give you signs, and often it's not what is present, but what isn't. So, like they're not being at a social event or not taking care of their crops. Next slide. So, we want to be able to ask, if we see those signs, are you okay? It's really not a problem for you to ask them if they're okay or not. Many people think if you ask someone who's thinking about suicide whether they're okay, that it's going to push them over the edge to complete suicide, when actually it's going to be a relief to them that someone thought, paid enough attention, and did ask them. Next slide, please. So if you do see those signs and you're thinking about reaching out to someone, one of the first things, you need to make sure you're in a good place yourself. So if you're not in a good place yourself mentally, then you want to ask someone to go with you, or ask if they would speak with the person. But you always want to do this in private and respect their confidentiality. Truly listen. Let them know that you care about them. Do ask directly if they're thinking about suicide, and encourage them to seek help. And I know that in many countries there are limited resources. However, one of the things that ECLT will share with you is, I did do a handout for all the countries on the list that Innocent gave me. And if there is a suicide crisis line or some resource available, then I have provided the number, the website, and a QR code for those programs. So you want to familiarize yourself with what's available so that you can share it with others. And you know what farmers want, or other people who are feeling hopeless, is to know that someone cares about them. That you don't need to debate about the value of life or saying, oh, this is not a problem. You don't want to go there. You really just want to say, I care. You know, can we get some help for you? Next slide, please. And this is my last slide before I turn it over to our other guests that are with us today. But this is the Live Life resource that I told you about from the World Health Organization. And I do hope that you will download this, and because it has great suggestions. And some of the primary things they have here are things that I've already mentioned: limiting access to lethal means or means of suicide. You want to interact with media so that they are doing responsible reporting about suicide. We want our youth to be able to have life skills that include how do you care for yourself, not just physically, but mentally. Have this conversation with them and provide the skills that they need to be successful. Think about some of those warning signs that I told you about. Early identification and support for people who are struggling can make such a difference. But, there's a couple of other things I want to say is that this is not an issue that any one of us can successfully manage on our own. It takes partnership, and whether that's coming together for training, for finance, for publicity, for prevention, it takes true partnership to be able to address this from the farm gate all the way up to national and international policy. That's what I have to share with you. And with that, Victor, I think we were able to move along to one of our other speakers.
Thank you so much, Robin. I really enjoyed your presentation, and the key takeaways for me is the best practices that you have shared, and the importance of self-care and yeah, trying to reach out to talk to family and friends and try to be openly to speak openly about the issue. It's something that we need to highlight.
Absolutely. Very
Great,
good.
thank you. So we'll continue the presentation with Childline Zimbabwe. They're going to so Munyaratsi, if you can take over the presentation, we can. So we're going to discuss the Zimbabwe experience, and Munyaratsi is going to share some insights from Zimbabwe. The floor is yours, Munyaratsi. Can you hear us?
Thank you. Yeah, just to touch base on the Zimbabwean situation, we are ranked as the 7th with the highest rate of suicide. That's according to the World Health Organization statistics as of 2020. And the surge in suicide attempts is reflective of the broader trend of suicides in Zimbabwe. There are quite a number of positive factors to that, and men in Zimbabwe have higher suicide rates than women, especially the elderly, accounting for 84.4%. Yeah, that's the broader statistics for the general overview in terms of the suicide rates in Zimbabwe. Can you skip to the next slide, Victor? And the major causal factors really hinges around failure to manage debts, which can lead to feelings of hopelessness and despair. A farmer would have borrowed quite huge sums of money for preparing for the farming season, to meet the operational costs, and in the end failed to manage the debts. This is one of the factors leading to suicides amongst farmers in Zimbabwe. Then issues of climate change, they are persistent in Zimbabwe, and farmers are having to grapple with issues of crop failure due to climate change related issues. And the major challenge is that most of the farmers, they lack crop insurance, especially the small scale farmers. So as a result, he or she may fail to keep up with the reality and end up committing suicide. Then men often feel humiliated after misuse of cash crop earnings or tobacco, especially from tobacco and cotton. And women also feel often depressed after realizing that a spouse has squandered the earnings from the cash crops. So at the end of the day, there will be limited support systems to support the other person, because in a household setup, this also compound issues of gender-based violence, and as a result, we will tend to realize cases of suicide amongst farmers. Then farmers have limited access to professional mental health support and counseling and crisis intervention services, which makes it difficult for farmers to cope with the stress. So around this, there's need to increase awareness raising among farmers so that there is help-seeking behavior. In such a way, would then reduce cases of suicide rates. Then the stigmatization of mental health problem, which may reduce help-seeking behavior among farmers. And also people tend to trivialize mental health problems compared to physical illness, leading to reduced help-seeking behavior among farmers. So a farmer may present signs of stress, signs of anxiety, but the people around him may fail to realize that this person is burning. So as a result, the person will end up committing suicide. Next slide, Victor. Then in Zimbabwe, there are social issues and beliefs associated with suicide. In Zimbabwe, suicide is associated with the spirituality, whereby if a person in the family has committed suicide, the spirit of the deceased will continue to claim more people through suicide in the family. That is the common belief in Zimbabwe. If one of the family members has committed suicide, there's a high probability that another family member within that same family will also commit suicide. Then some people also believe that people commit suicide because they would have done some rituals to get rich. We call it kuromba here in Zimbabwe, in the Shona dialect. Then crying at a suicide funeral is not allowed in most of the communities in Zimbabwe. If someone has committed suicide, when you attend their funeral, you are not supposed to cry. That's the traditional held belief in Zimbabwe. And in some communities in Zimbabwe, the body of the deceased is not acceptable in the house. They are taken to the gravesite straight after being taken from the funeral parlor or hospital, as they believe the spirit of the deceased will remain in the house. And just to emphasize that personal belongings of the people who commit suicide are not distributed. They are buried with the deceased. They think that by so doing, will be cleansing the spirit so that it will not continue to haunt the family. And all this may have adopted the of discouraging suicide deaths in the family. So from the tradition, the reason why in Zimbabwe, why this is being practiced is perhaps a way of discouraging suicide deaths amongst family members. Next slide. Yeah, I think Robin has touched on the effects of increased suicide rates by farmers, the issues of lost workforce productivity at family, community, and national level. Then there's lost income at family, community, and national level, and an increase in the orphans and vulnerable children population, which is overburdens or restrains the available social safety nets, be it at family, community, and at national level. These are some of the effects of increased suicide rates by farmers. Next slide. Then in Zimbabwe, in terms of the formal support systems that are available for farmers, in terms of the legal mandate or statutory mandate, it falls within the purview of two ministries, that the Ministry of Health and Child Care and the Ministry of Public Service, Labor and Social Welfare. The Ministry of Health and Child Care employs clinicians and clinical social workers, whereas from the Ministry of Public Service, Labor and Social Welfare, the majority of the professional workforce, they are mainly social workers. So in terms of statutory mandate, these are the two ministries that are responsible for managing human welfare and responding to cases of mental health. Then the Ministry of Health mainly focuses on inpatients with serious mental health issues and those recovering from suicide attempts. But the challenge that we have here in Zimbabwe is that only at provincial only provincial hospitals have mental health units, and they are not available at the district level. Whereas the majority of farmers, they are found at district level, where these mental health facilities are limited. The mental health nurses are available at the district level, and it's normally one per district, with other district not having due to brain drain. So the skilled manpower is migrating to developed countries, and at district level, some of the facilities, they are not even manned by the qualified health professionals, which leaves a skills deficit gap in terms of managing farmer stress. Then people who attempt suicide are discharged from hospital after they've seen a counselor or a psychologist or a social worker who help to change the negative thoughts of suicide to positive ones. Next slide. Then the Ministry of Labour, Public Services, Labour and Social Welfare, on the other hand, has the responsibility on offering counseling services to both adults and children with the social issues which may deteriorate to mental health problems. Social workers offer those services under the Department of Social Development. Then at Department of Social Development, the social workers are at district levels only, and they're often overwhelmed due to very high workloads. So according to the workforce survey that was conducted by UNICEF in Zimbabwe, it was established that the client to social worker ratio is 1 is to 50,000 children. So if we are to add to that bit to look on the farmers, it means the social worker will be overwhelmed to provide quality comprehensive services. And social workers, so in Zimbabwe, there's a concept called the one-stop center, which is gaining popularity. This is whereby clinical services, counseling, victim-friendly services, and legal services are stationed under one roof to enhance access to post-violence care services, which is one of the main causes of mental health problems among farmers. This is also cost-effective in terms of managing distances that a farmer would have to, or a patient would have to travel to access one service. The service is then found at one place, and all the qualified personnel are there. That makes it easy for the client to access comprehensive services under one roof. But however, the one-stop center is mainly being funded through private voluntary organizations. So due to funding fatigue, it really becomes a problem, especially to roll out the initiative to all the districts in Zimbabwe due to funding challenges. Next slide. In terms of the informal system supporting farmers' mental health issues, I've talked broadly about the formal structures, but here in Zimbabwe, the community structures are closely knit, such that we rely heavily on informal systems like churches, family members, friends, community leaders, traditional leaders. However, these informal systems cannot be entirely relied on. Some may work against the intended purpose of saving lives unknowingly, since they are not specialists in mental health issues. So the challenge is that these are unqualified, these are unskilled personnel. So what we probably need now to invest through the work of private voluntary organizations like Childline is to capacitate the community level structures so that they have sound understanding of how to manage mental health issues. And since they stake to farmers, they are resident in the communities, it's also cost effective. So what we just need to do in terms of recommendation is to invest in capacity building these community level structures. Next slide. In terms of recommendation, I would also say there's need to establish online platforms where farmers can access mental health services for free. So some of the farmers, they are better off in the sense that they can afford to buy to buy data. So what I've observed is that the farmers are entitled to resource systems, but they may not be aware of the existence of some of the mental health facilities that are available. So there's need to establish online platforms where farmers can access mental health services for free. And even if you look at our available helplines, we also have some a WhatsApp line agents who can respond to issues of farmer stress at any given point, because it operates, the hotline operates 24 hours a day. We run day and night shifts. So in the event that there's a farmer who is in need of assistance, he or she can easily tap from the online platforms that are available. That's the counseling service. Then in terms of non-governmental organizations, they can also initiate and support community groups for farmers, where we create support groups for farmers to share their lived experiences and support each other at the community level. And then there's also need to promote health and awareness programs to help farmers manage stress and improve their well-being. The health and wellness programs can be conducted by non-governmental organizations and even by private companies like tobacco companies, while it's supporting the farmers who are under their grower base. And the non-governmental organization can also play an advocacy role, where we advocate for policies and programs that are pro-farmers, that support farmers' rights, such as fair pricing and access to credits and loans. It's also one of the issues that private voluntary organizations can play. Then there's need to raise awareness, and trainings should be conducted to encourage farmers to prioritize mental health issues and encourage them to normalize seeking help on mental health cases. Remember, we said the issue of mental health is trivialized. So at the end of the day, some of the farmers, they end up committing suicide just because there is limited help-seeking behavior. So there's need to educate the broader community, the farmers, and this can be done through radio programs or community level awareness raising. Then there's also need to continuously invest in a research to address the problem of mental health. And this challenge will be done by the nations together, each associations being involved in raising awareness on mental health. Thank you, Victor.
Thank you so much, Munyaradzi, for your presentation. It's very interesting to see your recommendations and to see how we could implement systems that so that farmers can access mental health support. Thank you so much. I would like to move forward with Moses Mukabeta's presentation. So he's ECLT's consultant in Zimbabwe, but he's also a farmer. He's very experienced, and he's got his own farm with different crops not far from Harare. So we would like to hear from him on his experience on this topic. So please, Moses, could you please take the floor? You have 5 minutes.
Thank you very much, Victor. I just want to check whether you can hear my voice.
Yes, we can hear you loud and clear.
Thank you very much. So I think some of the points that I want to raise and share with you in this webinar, some of them have been mentioned by Robin, and I would like also to say thank you to Munyaradzi, who has mentioned some of them. So in terms of, do we have cases of suicides among farmers? the answer for Zimbabwe is yes, we do have them. But we need also to understand the pattern related to these. These cases of suicide largely occur during harvest season, and this is also the selling time for our summer crops, mainly tobacco, cotton, maize, and sometimes we have also a few others. But we need also to understand what are the causes of the cases of suicides that we hear and that I have also witnessed in the area where I have a small farming enterprise. When farmers fail to service their debts, and sometimes they are failing because of the climate change, there hasn't been enough rain, the crops, or rather the produce wasn't that high, and the sales cannot cover the inputs that were borrowed. And sometimes also low prices from our buyers, the market dynamics and the like, they do lead to some farmers deciding to take their lives. Disputes among families, sometimes I think Mnyaradzi has mentioned this, when one of the spouses squanders the income and comes back home without anything, there are disputes, and this sometimes also leads to cases of suicides. So the other point I just wanted to underline as Zimbabwe is concerned, it's the traditional patrilineal society and power relations. The men tend to be more powerful, but of course, when the wives come up and say, no, no, we should not do it that way, and this leads to disputes, and sometimes it is the husband who takes his life. Sometimes it is the wife also who takes their life. Go on to the next slide, Victor. Yeah, so I think Mnyaradzi has addressed this very well. There are social issues related to suicides. This is considered a taboo. It's a bad omen for the family, and it's a bad omen for the relatives, and hence they take on some of the actions that Mnyaradzi has made reference to. Just before I shut up, I just want to mention one big general intervention which has been happening over the last few years. And this is the Spotlight Initiative, which brought together a number of UN agencies, the European Union, and the government of Zimbabwe, the ministries that Mnyaradzi mentioned. But they are addressing the broad issue of gender-based violence, and the interventions has been to promote discussions, to promote a lot of openness, so that spouses get to respect each other, to talk to each other more on the challenges they are facing, be it in their farming and so on. But the whole purpose is to promote behavior change among men and boys towards women and girls. So after something like 4 to 5 years of intervention, we are beginning to see some changes in this. But nevertheless, even if some cases of suicides are being recorded, there is still a lot more that needs to be done. Yeah. Then I think the other one, again, Mnyaradzi has made reference to this one. At community level, we have the police officer working with the clinics, with the health ministry institutions, again, to promote peace, harmony, skills for conflict resolution at family household level. Otherwise, I'm just buttressing some of the issues that were raised by Mnyaradzi in the case of Zimbabwe, but it is true that some of the things said by Robin also apply in our case. Thank you very much, Victor. Back to you. Over.
Great. Thank you so much, Moses, for that insightful presentation of Zimbabwe. So we'd like to move forward to Malawi's experience. So Andrew, I don't know if you're in the call. Could you please unmute yourself if you are?
Thank you so much, Victor, and thank you, Robin, and all other speakers that have spoken. I think my presentation is also just to make a kind of a wrap-up kind of in terms of what has already been shared by Robin. I think I'll just give a perspective of the Malawian situation, focusing on the questions that were shared to look at. First of all, let me indicate that Malawi is an agro-based economy where we mostly depend on the agriculture for our livelihood. And our agriculture is it can be categorized into two. So we have the smallholder farmers as well as estates that are operating. And Malawi's agriculture accounts for 30% of our GDP. So it's a very important area. Farming is a very, very critical area, both for the economic support as well as food security. Can you next, please? So to answer the question, have we seen an increase in suicide among farmers? Formally, I would say no, because of what Robin has already explained. In Malawi, we do not have that clear data in terms of suicide cases, especially in agriculture in particular. So it's quite difficult to really pull out data in terms of to say these are the suicide cases among farmers. It's quite difficult to actually come up with that kind of data. So my answer has been no, because it's not, that data is not clearly available. However, there are cases that are likely to happen, especially if we look at the suicide cases in general. There could be that a good percentage of those suicide cases, general suicide cases, are also coming from the farmer side, and because of the agricultural challenges that farmers are experiencing in their farming business. Next. So, if those cases are there in the agriculture sector, which are likely, as I indicated, what could be the causes? There are several causes of which I look at as the main or potential causes of suicide among farmers, some of which has already been mentioned by my colleagues in Zimbabwe. They are quite similar. So I'm looking at issues to do with crop failure, increase in prices of inputs, but also you look at issues to do like what has already been mentioned in Zimbabwe is also similar here. We look at the prices when farmers harvest their crops expecting that they will make money out of that, and they end up selling the produce at the low prices and even failing to recover what they invested in the farming business. And that are likely to be the potential causes of suicide among farmers. But also, next slide, I'm also looking at, now I've categorized the two other major causes, like the natural and economic disasters. For example, you're looking at issues to do with the heavy rains, which will result in floods. In Malawi, we've been experiencing that, like the last but 1 year, where we had floods happening in most parts of the country, crops being washed away, animals, livestock being washed away. And that kind of scenario would actually cause stress among farmers. And I think, as Robin has rightly put it, is you'd find that farmers care more about their crops and livestock more than they care for themselves. And when they lose what they care for, that causes stress. And that stress may result into the farmers committing suicide. So I think those are some of the issues. Another natural disaster could be drought. Like last year, just the ending season, Malawi experienced drought. We received our rains very late, and they did not even last long in order to sustain the crops. And most farmers lost their crops. The harvest wasn't that good. Most farmers did not realize as they expected. And looking at the investment, the amount of investment made in the business, vis-a-vis what they have realized from that, that also would be a recipe for stress that could end up into committing suicide. Issues of hailstorm. There was a year in Malawi where most tobacco farmers, especially in the central and northern part of Malawi, lost their tobacco crops due to hailstorm. You'd look at a farmer who had taken care of the crop, had put in a lot of inputs, fertilizer, chemicals, labor, and hailstorm just came within an hour, the whole crop is lost. And that could also be a recipe for suicide, because the farmer would look at how would I recover the investment that I have actually made into this farming business. Then next slide. Yeah, at the same time, before this slide also, I would also look at, in Malawi, the inputs have really gone so much high. The fertilizer prices has almost tripled. And this makes it difficult for most farmers to really do their farming business in a way that they would have loved to do. As a result, any slight losses that the farmers would make is either the farmer had borrowed the money through the banks or other avenues where they managed to borrow the money, and the losses would actually end up like saying, where will I get the money to pay back all these loans? And as a result, that would actually make a farmer to say, okay, the best thing, as Robin has said, is that I should just take my life away. Possibly my family would be better without me. So these are some of the major issues, the natural disasters, as well as the economic challenges that the agriculture sector or the nation as in large we are going through, which have got the potential to really make a farmer to commit suicide. So what are the social issues, beliefs associated with suicide? Normally, because we do not really look at mental issues, challenges as real issues, people would actually translate to say, I know that person is weak-minded, because a real man or a real person, a strong person, would not commit suicide because of that. So those people would be looked into as being weak-minded or lack of care and love for his or her family, because they say if he really cared for his or her family, wouldn't have really committed that suicide and put the family in problems, leaving children as orphans. But also issues of they are looked upon as being careless. And this actually makes the families of those people that commit suicide to be looked upon as not strong-minded kind of people. And it also further on makes the rest of the remaining family members to be stressed more because of the issues, discrimination that is coming from the community, because they are not looked upon with a positive mind, but rather they are looked as not really serious people, but also as not very important in dealing with their own issues. So the social belief, the issues and beliefs makes even creates the potential ground for even the remaining household members to further feel stressed, also think of even committing suicide more. So there is that chain of connections in terms of the attempts to commit suicide. Next, Victor. Yeah, so are there any programs, formal or informal, currently in place? Generally, I would say they are just general programs, not specifically looking into farmer challenges in terms of the attempts to commit suicide by farmers. So, but they are just general. Just as Robin shared some of the links, some of those in Malawi, they are there, but not specifically focusing on the farmer issues, but just general general issues. So that's what I can actually say. In terms of recommendation, I think looking at the level at which farmers experience stress and other challenges, I think it's important for farmer organizations to really consider bringing in some sort of counseling programs, especially when farmers are going through stressful moments or stressful times due to droughts, hailstorms, floods, or even just the economic challenges that farmers are going through. So if there could be programs that could actually look at how to deal and help farmers specifically deal with their issues and be able to reduce the levels of stress among farmers, that would really help. So I think my recommendation would be especially looking at the farmer organizations, the farmer groups which, that are helping farmers to actually do their farming business. They need also not to overlook this issue of stress management among farmers, which will help in the end to reduce suicide cases among farmers. But at the same time, will also help to kind of understand how much, what the level of suicide among farmers in Malawi is. So we can actually validate in terms of whether there are those cases or there are no cases, other than just looking at the suicide situations as in general terms without necessarily pulling out how many cases are there among the farming communities. So this is what I wanted to share, but I very much appreciate also what other speakers have already said and shared, and it resonates very well with our situation in Malawi. Thank you very much.
Thank you so much, Andrew, for this presentation on Malawi's reality on this critical issue. So I would really like to invite people to share your insights and questions. So please raise your hands if you have if you like to share anything, or you can also write on the chat box. So I believe that Pascal and Abby raised their hands earlier. Yes, Pascal. Pascal, can you hear us? We cannot hear you.
Maybe Pascal, you can use the chat box and we can read your question.
Yes, exactly. Euclimia has a question as well. Hi, Euclimia. Maybe you can share some insights of your experience in Mozambique. You are muted, so we cannot hear you, Euclimia.
Hello?
Yes, we can hear you.
Sorry, Victor, you said the chat box is disabled. So can you attend to that while Euclimia is speaking?
Yes.
So sorry, I don't know if you allow me to speak in Portuguese as well.
Yes, I can take notes and I can translate your question or your
Oh, thank you.
comment.
Muito obrigada. Quero primeiro agradecer pela sessão de hoje. É, de facto, um tema muito importante na nossa sociedade. Aqui em Moçambique, infelizmente, ainda não temos muitos registros escritos sobre esta questão de estresse e suicídios a nível das farmas, não é? Mas temos sim casos que muitas das vezes estão relacionadas mesmo com aquela questão que a primeira colega acabou levantando aqui, questões climáticas, questões financeiras, e tudo isso acaba desencadeando um rol de estresse para os nossos agricultores. A agricultura é a base da nossa sobrevivência aqui em Moçambique. Muitas comunidades dependem somente da agricultura, muitas famílias têm na agricultura a fonte de subsistência. Então, temos tido casos, infelizmente, em que as culturas acabam não tendo aquele rendimento que era necessário, que era previsto, e desencadeando situações não muito agradáveis para as comunidades. Quero apenas agradecer, na verdade, e dizer que esse estudo, se fosse possível, compartilhar conosco a gravação que estamos aqui a fazer, e seria de veras importante. Obrigada.
Thank you very much, Eclimia. So Eclimia was thanking the entire organization of this webinar. She believes it's a very important topic, and there are many cases related to these issues that have been raised here during the webinar in Mozambique. In Mozambique is an agriculture-based country, and the communities are very exposed to these kind of issues, and women and men working in farms are suffering from stress, and she believes that it's a very important topic, and she would like us to share the recording. So Euklimia, yes, we're going to share the recording. Sorry, I cannot respond in Portuguese, but we're going to share the recording after the webinar. So we'll keep in touch.
Thank you.
So anyone else would like to share insights or questions or comments before moving forward to the closing remarks? So Innocent, I think we can. Oh, there's a question on the chat. So hello, Victor, and all the participants. Sorry I cannot get through due to poor connectivity, but Pascal just wanted to say that in Zimbabwe, as indeed elsewhere on the globe, access to chemicals is one of the major causes of suicide among farmers. Yes, most definitely. It's as Robin was mentioning, yeah, there are chemicals, other kinds of ways of harming yourself, unfortunately, in this world. So yes, that's indeed an important comment. So Innocent, for the closing remarks, I give you the floor.
Thank you, Victor. Maybe I can share my screen so that I just go straight to the point.
Yes.
Can you enable the screen sharing?
Yes, it's done.
All right, so I've been taking notes like crazy while you, from Robin to Andrew to Moses and Childline when you were speaking. So I just want to summarize what has been going on with the key takeaways. I think it is Andrew, was it Moses Mkabeta who really mentioned this important point. One would wonder why ECLT Foundation, being an organization that works on child labor, why are issues of farmer stress and suicide important? For us, they are very important because they relate to farmer livelihoods. And when we speak about a livelihood, we are talking about three things. We are talking about the physical assets that somebody has. We're talking about the mental assets, but we're also talking about social capital. So this goes to one of the important elements of livelihoods, which is the mental one. That if the farmer is stressed, is depressed, then they are not in a good space to take care of their family. Then they may die and leave children orphaned. And our own research, I think a couple of years ago, showed that children who are orphaned had 33% more likelihood of being in child labor than children who are not orphaned. So you can see that orphanhood due to suicide or other causes, it really is a driver of child labor. That's why this topic is important to us. So some of the key points that I took from all the presenters was that from the US to Zimbabwe to Mozambique, from Crimea to Zimbabwe and Malawi, it looks like something is happening in farming communities. This is pretty much common, even though there's not been much research, especially in our developing countries. There's not much research and attention paid to this, but it is an issue. Data quality is an issue because often it's just mentioned that somebody has died of suicide, but it's not very often that they would say it was because of this debt that they taken, or it was because of sometimes it's not linked to the farmer's profession. It's just taken to be, especially in the case of where death by suicide is taboo. It might be they may say it's attributed to death due to bad spirits in the family. There are several tools that farmers can use. Robin mentioned those. I think this will be important for us to mention. Farmers can use themselves, but also caregivers, people who are concerned, who work with farming communities like ourselves, can use to identify and manage farmer stress. Early identification is critical, and also the management of farmer stress is critical. So it means that if we are able to identify ahead of time that somebody is stressed, that somebody is under some form of mental distress, then we should be able to intervene and save a life and possibly prevent child labor and other forms of child vulnerability. Some key recommendations, I just listed 3, but there have been more. From Childline, they said because of the problems with access to cell phones and telephones, the problems of access to internet, the problems of very few social workers in farming communities, that it is essential to strengthen community care management systems using community structures, informal as they are, but strengthening those through giving them training and tools so that they can better intervene, better identify and manage cases of farmer stress and possibly prevent suicides. I think there's been a challenge thrown by Moses Mkabeta, or was it? No, it was Andrew, about the critical role of farmer organizations to set up programs for addressing farmer stress and suicides. One of the issues that was raised, which we didn't speak about much, is when we talk about farmer and farmer stress and farmer suicides, we should not forget the workers that are on that farm. So the issue of farmer worker suicides, the issue of worker stress, I think is also important. If the farmer is stressed, chances are the workers are also stressed or will be stressed or will be vulnerable in some way, or his workers will be vulnerable in some way. So we need to be talking about farmer stress together with worker, farm worker stress. The third recommendation was, of course, the setting up of helplines. The last point I would like to make is about corporate responsibility. So Pascal mentioned the issue of easy access to chemicals. There was farmers also have relatively easy access to firearms, because they can apply them for those firearms. Even in developing countries, they are allowed to apply for firearms, and they have firearms. What is the responsibility of the company that has given me as a farmer pesticide? And then I use that pesticide to commit suicide. What is the corporate responsibility? What is the responsibility of the company that has given me a debt of 10,000? And because of a bad season or my own mismanagement, I'm not able to repay that money, and then I commit suicide. What is the responsibility of the company? Why should this issue be of importance to company? We've spoken about farmers organizations, workers organizations, but I would also want to argue that there's a corporate responsibility we should be thinking about. And this corporate responsibility comes from United Nations Guiding Principle number 13, which says companies have a responsibility to respect human rights, but they can cause adverse human rights impact through three main pathways. One is they can cause the human rights impact, they can contribute to human rights impacts, negative human rights impact, or they can be linked to negative human rights. So the company doesn't necessarily just have to push the farmer directly into committing suicide. But if there is a product supplied by the company to a farmer and then the farmer misuses that and commits suicide, surely there should be some level of responsibility according to the UNGPs. Either the company is linked or it has contributed. The ILO and the IOE have provided very good examples. If you want another resource that can help you to understand where the corporate responsibility on this topic comes from, you can visit that resource. It is called IOE and ILO resource on or guidance on child labor, on business and child labor, I think. Then they also provide some guidance on what the company should do. So either the company should be actively involved in preventing or mitigating the negative human rights impact. If the company is linked to farmer suicide and farmer stress, then they should take some responsibility, take some action alone or with others to make sure that they are preventing that negative or adverse human rights impact. So this is what I've been able to get from the various presenters. I want to thank you, thank them so much for these insightful presentations, and I hope we are going to pick up this conversation really to start programs that can help us to address these challenges. Thank you, Victor.
Indeed. Thank you so much, Innocent, for these key takeaways and recommendations, and also the importance of corporate responsibility on the issue of mental health. Thanks everybody as well for your participation and your comments and your suggestions. Again, we will share this recording early next week on our social media and our e-learning platform. And we'll keep up the conversation. Please reach out to me if you have any further questions or comments. Thank you so much.
Victor, sorry, there are a couple of questions that are in the chat box. If you have 5 minutes, perhaps the presenters could address any that are burning. Sorry
Yes.
for taking a bit of your time.
No worries. I see some comments. So for example, as an industry CSR approach to funding mental health experts and ministries of health to reach out to tobacco communities with various awareness initiatives.
Yeah. But there's an interesting comment which Robin made with regards to in the US packaging of some pesticides has been addressed to reduce the likelihood of pesticide ingestion. That would be interesting, Robin. Could you shed a bit more light on what that kind of packaging looks like?
Yes, paraquat is the main one, and I will actually try to go online and find that link to send you, Innocent. But paraquat is usually the chemical of choice here. And so the manufacturers have gone to a closed system so that individuals are not able to access the chemical in the same way, because of the way it's packaged and the way it moves from the chemical dispenser into the tank. There's no contact with it. It's manufactured in such a way that it would be almost impossible for someone to access it. So it's not a single container that someone could just drink from. So I think that's important to know that those kind of changes, have been made here in the US, and that if chemicals are being shipped overseas, then they should be packaged the same way. But I'll send you a link about that information.
Yeah.
Great.
There's also been a comment, Victor, from Godfrey Chimenya, who says an industry CSR approach to funding mental health experts and Ministry of Health to reach out to tobacco communities with various initiatives. Godfrey, can you elaborate what this could look like? Are you thinking of various companies contributing to some fund, and then they can facilitate the Minister of Health and other experts to go to communities to raise awareness? What do you really have in mind? If you can unmute yourself here, if you're still on the call. Maybe he's no longer on the call.
Yeah, I don't see him trying to mute himself.
Yeah. Okay, that's all. Those are the comments that I can see that are really questions that needed a bit discussion, Victor. Over to you.
Yes, great. Well, thank you, everybody. Thank you, Robin. Thank you, Andrew, Munyetsi, and Moses for your participation, and everybody for your questions and for your presence. And we'll keep in touch if you have any further questions. Thank you so much. Have a lovely rest of the day. Thank you.
Thank you. You too.
Bye.
Bye.
Thanks.